Hello everyone, my name is Carmen Aguirre, and today my presentation is going to be on the medication called Celexa. That's the brand name. The generic brand is called citalopram, and basically the description of the disorder being treated with this medication is called Celexa. Celexa is used to treat depression. Also, sometimes it could be used to treat eating disorders, alcoholism, panic disorders, premenstrual dysphoric disorder, and social phobia. What is the medication class? Well, Celexa is in the class of antidepressants called selective serotonin reuptake inhibitors, SSRIs. The mechanism of the drug action. How does it work exactly? Well, Celexa comes as a tablet and as a solution, liquid, to take by mouth. It is usually taken once a day in the morning or evening, with or without food. What does the drug actually do? You should know that your mental health may change in unexpected ways when you take Celexa or other antidepressants. Even if you are an adult over 24 years of age, you may become suicidal, especially at the beginning of your treatment and any time that your dose is increased or decreased. Also, this medication is hardly ever prescribed to children or teenagers because of the suicidal thoughts. So sometimes it is, depending on the doctor, but they usually do not prescribe it to any children or teenagers. How quickly can the client expect to notice results? It may take 1 to 4 weeks before you notice the full benefit of Celexa. What side effects might the client reasonably expect? Well, some of the side effects, the common ones, could be nausea, diarrhea, constipation, vomiting, stomach pain, weight loss, frequent urination, excessive tiredness, yawning, weakness, muscle or joint pain, dry mouth, changes in sex drive, heavy menstrual periods. Also, what might be some signs that the client ought to call their doctor about? Some side effects can be serious, and this is when you need to call your doctor or call 911. If you experience any chest pain, dizziness, fainting, fast, slow, or irregular heartbeat, hallucinating, fever, excessive sweating, confusion, rash, hives or blisters, hoarseness, or seizures, you must call your doctor or call 911. Call the emergency number. Are there certain other medications, recreational drugs, or alcohol that might cause a bad reaction with this medication? And if so, what kind of reaction could be expected? Well, yes. It says that if you are allergic to Celexa or to Lexapro, you need to let your doctor know. Also, you need to let your doctor know if you're taking any vitamins, if you're taking any non-prescription medications such as ibuprofen, naproxen, anticoagulants. If you're taking any medication off the counter, you need to let your doctor know. Also, any other medication that you have prescribed. Also, it says to let your family know about it. You should know that Celexa may make you drowsy. Do not drive a car or operate machinery until you know how this medication affects you. Talk to your doctor about safe use of alcoholic beverages during your treatment with Celexa. Alcohol can make the side effects of Celexa worsen. What special dietary instructions should I follow? If you're asking yourself, unless your doctor tells you otherwise, continue your normal diet. What should you do if you forget a dose? Take a missed dose as soon as you remember it. However, it is almost time for if it's almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take double dose to make up for a missed one. Is blood testing required to monitor the level of the drug in the bloodstream? And if so, how often? No, there's no blood testing required to start taking this medication. At least I did not read it anywhere in my research. What are the risks of discontinuing the drug without consulting a doctor first? Well, some of the risks, if you suddenly stop taking Celexa, you may experience withdrawal symptoms such as mood changes, irritability, agitation, dizziness, numbness, tingling, or electric shock-like sensations in the hands or feet. If you're taking this medication, do not stop taking Celexa without talking to your doctor. When you talk to your doctor and tell your doctor how you're feeling, they should lower your dose until they can go ahead and discontinue the medication. But you should never stop the medication by yourself. Is there any risk of overdose? What signs should the client watch out for that might indicate an overdose? In case of an overdose, call your local poison control, call 911. The symptoms of overdose may include the following: dizziness, sweating, nausea, vomiting, uncontrollable shaking of a part of the body, drowsiness, fast, irregular, or pounding heartbeat, memory loss, confusion, seizures, coma, fast breathing, bluish color around the mouth, fingers or fingernails, muscle pain, dark colored urine. Other information you might want to know: keep all appointments with your doctor and lab work. Make sure that you do it. Your doctor may order certain laboratory tests and EKGs. EKGs is a test to monitor your heart rate and rhythm before you start taking Celexa and during your treatment with this medication. Do not let anyone take your medication. Ask your pharmacist any questions you have about refilling your prescription. And it is important, very important, to keep a written list of all the prescriptions and non-prescriptions over-the-counter medicines you are taking, as well as any products such as vitamins, minerals, or other dietary supplements. You should bring this list with you each time you visit your doctor or if you are admitted to a hospital. It is also important information to carry with you in case of an emergency. Another thing that I'm going to share with you guys is that when I talk to my clients and they start a medication for their mental illness, I like to give them a form called my personal medicine worksheet. And basically, I'm just going to put it here. Let's see if you guys can see it. And basically, what I do is I just go over it with my client, and it helps them to actually, it's personal medicine is an activity someone does because it helps them feel better or increase their wellness. And what we do is what we do there in the session is I talk to them and I tell them that you need to exercise, you need to do things for you, and so that they can feel better. And this is what I use to help them with the process of starting a medication. Also, I give them a personal medicine calendar, and that way they can go ahead and use this to write down or journal when they took their medicine and how they're feeling. The name of their medication also. So here it goes. It's this one right here. And so that concludes my presentation. Looking forward to watching you all's presentations. And thank you so much.